Hi, I'm Dr. David Weiss, and today I'm going to talk about something called plantar plate dislocation, which is a very common problem seen in people who wear heels, people who are on their feet all the time, and then sometimes it just happens with sports injuries. What happens with this is the bottom of the foot, the toes, are connected to the rest of the foot by something called the plantar plate, which is like a giant rubber band. And then this plantar plate is an extension of the plantar fascia. We've all heard the term plantar fasciitis, which is usually pain and inflammation along the plantar fascia. But moving forward towards the toes, on the bottom, the plantar plate comes in and holds the toes straight. It's very common to have an injury of that plantar plate, and when it gets loose or when it tears, what happens is the toe no longer is being held straight, and the toe can start to become crooked. So when plantar plate dysfunction becomes bad and it keeps on hurting, oftentimes this toe, mostly the second toe, will start to become crooked, and that's called a hammer toe. And when we have this condition, plantar plate dysfunction or plantar plate dislocation, we want to stabilize the toe and make sure that the plantar plate can heal properly. Some of the ways we do that is using tape, believe it or not, sports tape. We can also put someone in a small boot. We never ever do cortisone shots to this area. Cortisone can make it worse, believe it or not, but it's common for cortisone shots to be used to the front of the foot in the plantar plate for pain, but in the long run, the cortisone will wear down the tissue. And unfortunately, those need to be repaired with surgery. One of the exciting new treatments we have for plantar plate dislocations and plantar plate tear is using platelet-rich plasma, or PRP, and or placental stem cell tissue. What I'm doing is I'm injecting this material into the plantar plate, and the tissue is being repaired, and the patient can avoid surgery for this condition. It's very successful if caught early. The other things we can do for this is surgically repair it, and this is something that we do often. A wonderful new system we're using that stitches or repairs the plantar plate so it comes back to its normal anatomy and straightens the toe without having to use any pins.